Hi, my name is Isabel Cortopassi. I'm one of the thoracic radiologists at Yale, and I'll be talking to you about the anatomy of chest CT imaging. The first concept that I want to understand regarding computed tomography imaging is the multiplanar capability of displaying the same images. On the top of the screen, we have axial images through the chest displayed in mediastinal window on the left and lung window on the right. At the bottom of the screen, we have coronal and sagittal reformatted images, left and right respectively. I want you to see the relationship between these images. As I scroll through the axial images, you can see where we are on the sagittal and coronal reformatted images. Here at the level of the great arch vessels, then we reach the aortic arch, as you can see on both of the images. Continuing going down, we are at the level of the carina. Then we get to the atria and then ventricles, lung bases, and upper abdomen with the liver and spleen. Now, let's start by reviewing the anatomy of the chest on the CT images displayed using mediastinal window on the axial plane. Starting at the level of the thoracic inlet, we have the neck vessels, internal jugular veins, common carotid arteries. You have the thyroid gland around the trachea, the neck muscles. Let's follow the vein anatomy first. You follow the internal jugular vein on the right. It converges with the subclavian vein to form the brachiocephalic or innominate vein. The right and left innominate veins come together to form the superior vena cava, which receives the azygos arch and continues caudally to the level of the right atrium. If you follow the right atrium inferiorly, you can also see the inferior vena cava coming from the abdomen to drain into the right atrium. Going back to the level of the thoracic inlet, we can now follow the arteries back to the aortic arch. You have the bilateral common carotid arteries. On the right, there's together the subclavian carotid, forming the innominate artery or brachiocephalic artery. Left common carotid, left subclavian, and this is the aortic arch. The normal branching pattern of the aortic arch is a 3-vessel branching like this, but you can have variations. If you follow the aorta downwards towards the heart, you can see the ascending aorta going down. Here we are at the level of the pulmonary arteries, the main pulmonary artery, right and left. And we can see the connection of the aorta to the left ventricle and the pulmonary artery to the right ventricle. The right heart chambers are anterior, right atrium, right ventricle, separated by the tricuspid valve, and posteriorly we have the left ventricle and left atrium separated by the mitral valve. The descending thoracic aorta continues inferiorly to the level of the diaphragmatic hiatus. We can also see the azygos and hemiazygos veins in the posterior mediastinum. Other mediastinal structures include the esophagus that goes from the cervical level, interthoracic, runs posteriorly to the airways, and anteromedial to the descending thoracic aorta, towards the diaphragm for the diaphragmatic hiatus as well, to connect with the stomach under the abdomen. Can also be seen on coronal reformatted images. We're going from anteriorly, the level of the breast, through the right heart chambers, left. You can see how the pulmonary artery arises more anteriorly. Then we have the aorta, the aortic arch. You can see the great arch vessels bifurcating, trifurcating, and then the main pulmonary artery bifurcating to right and left. we go posteriorly to the level of the spine. Same anatomy can be appreciated on the sagittal reformatted images. As we go from left to right, we can see the subclavian artery and vein. Under the left clavicle, we get to the chest. The first chamber we see on the left is the left ventricular apex. You can see the relationship anterior right, posterior left, the pulmonary artery arising here. Then we see the aortic arch, the three arch vessels, the right pulmonary artery on the right side, the superior vena cava coming down to the right atrium, and the branches of the pulmonary artery. Now let's look at the CT images on the axial plane using lung window so we can see the air-filled structures better. We start with the extrathoracic portion of the trachea going into the chest, comes down and bifurcates at the level of the carina. We have right and left mainstem bronchi. From the right, the first bronchus to arise is the right upper lobe bronchus. We have the bronchus intermedius bifurcating into middle lobe and lower lobe bronchi. On the left mainstem bronchus divides into left upper lobe and left lower lobe bronchi, with the lingula branch coming off the left upper lobe bronchus. We can also see the parenchyma. We have to get used to the normal grayness of the parenchyma. It is lighter than pure air in the trachea, but it's also darker than soft tissues. We can see the vessels crossing through the parenchyma, and there's always an artery and a bronchus coming together, but we also have the pulmonary veins that drain into the left atrium. We usually don't see the interlobular septa or the secondary pulmonary lobule unless it's abnormal. You can also look at the lung and airway anatomy on other planes, coronal and sagittal. This is a sagittal view. Going from the left, we can really appreciate the fissure, the left major fissure, dividing the left lower lobe and left upper lobe with lingula. The fissure is seen as this thin line with no vessels on it. As we go through midline, we can see the bronchi converging. The left upper lobe and left lower lobe bronchi form the left mainstem bronchus, and then to the level of the carina. Now we have the trachea, and going towards the right side, you have the right mainstem bronchus. The first bronchus to arise is the right upper lobe bronchus. You have the bronchus intermedius dividing into middle and lower lobe bronchi. The right lung has three lobes: right upper lobe, right middle lobe, and right lower lobe. The right lower lobe is divided from the other two by the major fissure, and the upper and middle lobes are divided by the right minor fissure. We can see the costophrenic angles are sharp and clear, and that's where fluid accumulates in case of pleural effusion. Upper and middle lobes are divided by the right minor fissure.